In this video, I'm going to be talking about the anatomy of the teeth. Now, if we look at this tooth over here, we could divide it into three basic regions. So everything above this line right here would be the crown area. The parts that are touching the gum right here and right here, this is the neck area. And everything below that would be considered the root. So if you guys remember from AMP1, this is bone right here. These are the alveolar processes right here. So now I want to go over the layers of the tooth. So the white layer that you see over here, the one that is exposed, this is the enamel. And as you can see, it does not go past the neck area. So you don't find any enamel in the roots. It's just going to be here in the neck and in the crown. The next layer is going to be dentin. So this is very similar, I would say, to bone. And if we look at it, it's pretty much continuous for the most part in the entire structure of the tooth. Next, you're going to have the pulp cavity. This is the cavity in the middle. What you see here are some veins, arteries, and nerves. Now, if you look, you could see that the veins, arteries, and nerves enter the root right here. So the part where they enter, this is called the apical foramen, and they travel through the root by the root canal. So this is the root canal right here. So let's look at the roots. If you look closely, you're going to see these lines over here. These are called the periodontal ligaments, and what they do is actually they help hold the tooth in place. Outside of the dentin, so this is the dentin, the dark yellow, you have a white layer here. This is called the cementum. And cementum is a very hard connective tissue. So what the periodontal ligaments are doing right here is that they're connecting cementum to the bone. Also, if you look at the dentin, the dark yellow, you could see these lines. These lines here are supposed to represent tubes, basically. There are tubes here in the dentin. And what they do is, if you have a cavity or something in the crown area, they communicate that to the nerves in the pulp cavity. So that's how you feel pain. So number 18 here, this is going to be the cementum. This is the enamel, this is the cementum. And then the dark yellow is dentin. Again, the light here is going to be cementum. Let's look at the teeth. So 1 and 2 are going to be incisors. Then you have 3, which is a canine. 4 and 5 are the premolars. And 6, 7, and 8 are molars. Number 8 is actually your wisdom tooth. So you get this a little bit later in life. So some models have this one and others don't. And just keep in mind that the gum in anatomy is called the gingiva. Here. And that is it.